Okay, so our topic today is talking about two children that we have worked with that we consider very challenging, and what were some specific strategies I used to address these challenges. And if I were to work with these children again, would I do anything differently, and why? So the example I'll use is when I was doing Camp Adventure. This class that I was in was with toddlers, and it involved a lot of additional guidance, and it was really hard to do because there were only 2 teachers and about 12 toddlers in the classroom. So a lot of challenging behaviors were about biting and hitting. So this made facilitating any kind of activity really stressful for us teachers. The kids would use really loud voices, there was a lot of touching and misusage of materials. So the first child I'm going to talk about, was about 33 months. He was really challenging in the way that he wouldn't take any kind of direction from us teachers. But I think the problem was he was never given direction in a positive way. It was always a very negative type of talking. So he didn't know what he could do. All it was you can't do this, you can't do that. And this was really reinforcing his negative behavior because it was the only attention that he would ever get was when he was doing something wrong. He would run a lot inside, he would stand on chairs, and he was potty trained, but if he didn't want to get up and use the bathroom, he would pee on his cot after he woke up or anywhere else in the room. He would also scream really loud if his name was said out loud in a way that he didn't like. So working with him, and it was only there for 2 months, but towards the end I noticed that what he really needed was positive attention and a lot of love. So he was there about 9 hours every day for the week, Monday to Friday, and he was without his parents a lot, and you could tell that they would bring him to the center because it was a way of getting rid of him. Even if the parents had a day off, they would still bring him there. He needed a lot of teacher guidance and attention in a very positive way so that he could focus on some sort of activity in the classroom. But again, this was really hard to do with 12 children and 2 teachers when one of us is doing diapers or cleaning something else up or trying to facilitate an activity. It was really difficult to address this child's needs because almost all of the children had some sort of behavioral problem. So being able to focus on this 33-month-old was a little difficult because there were some younger than he was that needed more guidance. The second child, she was about 20 months at the time, and this one caused the most injuries in the classroom. She would take out any kind of frustration on the child closest to her. So even if it was an adult or teacher that frustrated her, it was hard to tell when she was going to react because she was very sensitive, but sometimes not so sensitive, and with some selective hearing in there. So what she would do was turn to the child next to her and bite them extraordinarily hard, enough to leave blue marks, teeth marks, any kind of awful mark. And she would also hit really hard, scratch the face, anything. This was hard to control because, like I said, there wasn't ever kind of a warning. If it was teacher instigated, she was not always close enough to us or was closer to another child. If it was child instigated, this was also hard to catch because, again, 2 teachers, 12 to 13 kids, and we might not be close enough to her to catch her when she gets frustrated. What I knew the classroom needed were teethers. if we just handed out teethers to all these children that would bite, it probably would have solved that like anger issue, and we could have just given that to them when they felt angry, or they could have learned to ask for one when they wanted something to clench their teeth on. She also needed to learn how to control her anger. This probably wouldn't have been anything that I could have helped with, but I would have tried to give her those words that she needed, because she could talk and she could use her words. I tried my best, but it was really difficult to wrap that around her. Let's see. It would be easy to work closer with all the children, particularly these two, if there were more teachers. I would have loved to try and see a difference in any kind of method that I could have used using the guides to speech and action, especially because that's what the classroom really needed. The kids really needed attention and love and lots of words that they could have used, because they were at that age where they were learning to use their words.